For many parents, talking to their kids about the birds and the bees is the conversation they dread having most. However, when the tables are turned and the kids become adults, having the talk with their parents about sensitive health issues can be really uncomfortable. According to a recent survey of Canadian adults with living parents, adult children are concerned about their parents' risk of stroke but are not sure how to talk to them about it, and 77% were not aware of the increased risk of stroke associated with atrial fibrillation. However, it's important that these conversations happen. Starting up an uncomfortable conversation with your parents is never easy, even when you're older. So it may not be a total surprise that, according to the Leger survey, 60% don't regularly have the talk about health issues with their parents, and almost a third say they don't quite know how to start conversations with them about sensitive health topics. But having the talk is very important. A condition like atrial fibrillation or AF and its link to stroke. AF is a serious heart condition, which causes the heart to beat irregularly and can lead to the most severe and disabling types of stroke. Dr. Frank Silver stresses how important it is for families to talk about AF.
After the age of 55, the incidence of atrial fibrillation doubles with every decade, and atrial fibrillation-related strokes are often fatal. The problem is that atrial fibrillation is often unrecognized because it can have no symptoms. So it's very important for adults to talk to their parents and specifically discuss stroke and its risk factors. If they then talk to their family physician, they can determine if atrial fibrillation is present, because the good news is that there are specific medications that can significantly lower the risk of future stroke.
Canadian adults now have a new tool to help them break the ice. They can visit strokeandaf.ca to develop and send a customizable video featuring a barbershop quartet to their parents as a gentle door opener to start the talk. Also on the site is the Talk Tip Sheet, which provides helpful advice on how to approach this tricky conversation. Family member Jonathan Foster has had to deal with the effects of AF and stroke personally.
When you have a parent who's passed away from a stroke due to AF, and your other parent has now been diagnosed with atrial fibrillation, you kind of get a little concerned when they have to, go in for treatment and all that sort of stuff. But once they get into a program, you can rest assured that there's something in place that's going to help them.
Approximately 350,000 Canadians are currently living with AF. People with AF are 3 to 5 times more at risk of having a stroke than those without AF, and twice as likely to die from one. For those who survive the stroke, the disabilities can be significant. Paralysis, loss of speech and understanding, effects on the memory, thought, and emotional processes. For more information, visit strokeandaf.ca.